Up next, we've got David Haddick. David, please join me here in the studio. Welcome.
Hi, Dan.
David, you are the CEO of PSYCHeANALYTIcs.
You said it just. You said it just right. Thank you.
We were just talking about you with our previous guest. That's fantastic.
Yes.
Well, you have a platform that helps primary care providers treat substance abuse and behavioral health issues. Big problem. Big problem. Tell me about that moonshot that you're working on.
Well, the idea is that patients will be better served if the physicians understand the body, mind, and spirit connection. And they've been trained to do that in college and in medical school. So we try to fill in that gap so that they don't have to be concerned that they'll get stuck in an area that'll just keep the patient there and never ruin their whole schedule that day.
Right.
So we give them a report in advance of the day, at the beginning when they do their morning huddle, so that they can decide what other resources they're going to need during the day, whether it's behavioral health consulting, or it could be the case manager or social worker, or whether it's just a simple case of a medical situation that they're ordinarily able to handle.
Excellent. David, just move the microphone a little bit more in front of your mouth and make sure that all the audience can hear you just fine when they're listening in at home. So I want to understand that a little bit more. So tell me, just going back to that moonshot, why is this so important for the world that you tackle this problem?
Well, if you ignore the behavioral health issues that patients have with chronic disease, those patients cost 5 times as much to treat as a patient that doesn't have a behavioral health condition. If you ignore that condition, it's even worse. So the idea is to support them so that they really understand how they can participate in their self-care, and so that the doctor gets a better relationship because the patient acknowledges, this guy knows what my problems are. Have you ever left a medical office and asked all the questions you wanted to ask? We always zip the lip and say, oh no, he doesn't want to know that. By the time they've taken our questionnaire on their smartphone at home or wherever else it might be,
right,
they've been trained to understand that the physician is really interested if they have social isolation or bereavement or their anxiety over their job or their children. Mm-hmm. All these things interfere with their ability to take care of themselves, and they also cause a lot of the medical symptoms that show up. We call it somatization.
So David, why did you decide to take this on? Why is this important to you?
Well, personally, because I have a family history of mental health, and my first wife had a delayed postpartum depression that was not diagnosed, and it actually ruined her life.
Wow.
Because she was on the wrong meds for a couple of years, and the meds did as much damage or more damage than the underlying condition. So I'm really grateful that I had this opportunity on my 7th or 8th startup to do something for mental health.
That's great. It's a big problem, and it's something that I believe is now becoming more mainstream in terms of understanding this is something we need to provide as part of a health care system.
Yes, the government, we passed this law called the Parity Act in 2008. It took CMS 10 years to write the rules for it,
right,
and now it's an obligation, but doctors still they don't know what to do with it, so we're trying to give them, in a 30-second snapshot, what they need to know to have a productive visit with that patient.
Well, we're here in San Francisco for the StartUp Health Festival. What announcements do you have for your company?
We're very happy because StartUp Health has led us into 2 partnerships just this year. One we're announcing today with LifeWire, and another one we announced earlier in the year. And without that connection to other entrepreneurs, we'd be out there by ourselves. And so being in a community, in a group of innovators, we have found to be just so dynamic and so helpful. And now, of course, we have a chance today to meet dozens of potential investors.
Well, that's great. Congratulations on those new partnerships, and I'm glad that being a part of the StartUp Health family is really working out well for your organization.
It is. The coaching is good. We really appreciate that, and the meeting other people and being a part of a team that's going to make a change. We're very happy about that.
Well, we're here at the start of a new year, the start of a new decade. Anything else that we can expect that you want to achieve over the next 12 months?
Well, we've been introduced just recently into the student health services market, which is of the greatest concern. Colleges and universities have an accelerating problem with behavioral health issues, depression, anxiety, and suicidality. And we think we can make a huge difference in that market and prevent more problems. Our real goal overall is prevention, getting people identified early when they have mild to moderate conditions that are too easy to overlook. That's the main goal for us.
Well, I admire you for doing that. I'm glad that you're a part of it. Is there anything else you'd like to make sure that the audience hears about your business and what they can do to engage with your product and service?
Well, they can just go to PSYCHeANALYTICS.com and we'd be happy to follow up with them. And we changed our technology so we don't have to deal with EHRs. This was another big plus this past year. We go straight to the patient's cell phone, then it goes straight into our survey, and it goes straight to the doctor's office. And that's been a big breakthrough, because otherwise we had to put a tablet in the waiting room and it was pretty awkward.
Right.
So this is really handy.
Well, they can find more at your website. They can also find more about this company at startuphealth.com. Wish you a lot of luck over the next 2 days and the year ahead.
Thank you very
Thanks so much,
David.
David.